So joining us for more on this diagnosis is board-certified neurologist and the Virginia Spine Institute, Dr. Ella Akkerman. Dr. Akkerman, good morning to you. Welcome to Dr. Phil's Merit TV. Good to talk to you. So tell us more about this rare diagnosis, NPH. Many of us have heard nothing about it. So give us the information, the details here.
Thank you for having me this morning. It's a very devastating diagnosis to hear such a wonderful singer, wonderful person, having to cancel his tour schedule because of this. NPH stands for a condition called Normal Pressure Hydrocephalus. Hydrocephalus is a condition where CSF, spinal fluid, that bathes brain and spinal cord and provides cushion and nourishment for these structures when it builds up excessively inside the brain. Normal means that despite building up inside the brain, it does not raise the actual hydrostatic pressure inside the brain. So the symptoms of headache are usually not the case with this condition. Instead, this condition causes excessive pressure on the internal structures of the brain that result in worsening memory, worsening balance, and urinary urgency or incontinence, which are the three major symptoms of the condition.
Wow. Well, obviously, like you said, this is a very serious diagnosis. Of course, the Joel family has come out, and we just read their statements. They're being very positive as they approach this. What does the road ahead look like for Billy Joel?
So this diagnosis is very tough because in order to treat this, there are certain procedures that have to be done to see if the treatment is going to be successful. And the main procedure that is done is called large volume spinal tap, is where the spinal fluid is removed through a procedure called lumbar puncture or spinal tap. And the patient is examined right prior to this procedure, immediately after this procedure, and about a 24-hour period after. And if there's symptoms of balance problems, memory problems, and incontinence significantly improve, specifically the balance problem improves, that indicates that a patient may benefit from this treatment called ventricular peritoneal shunt, which is the procedure that Billy Joel probably underwent in March. And this procedure is supposed to be, if not curative, very beneficial, and a person can restore most of the function that they have lost due to the condition.
Yeah, I was just going to ask, can he fully recover from this? And then, of course, I know people at home watching right now are wondering, what are the symptoms that maybe the average person should be looking out for? You mentioned some things that he likely is dealing with, but can he fully recover, and what are some of the symptoms that people should watch out for?
So the symptoms, what makes this condition tough to diagnose is the symptoms come on insidiously or very gradually. And the symptoms of loss of balance, loss of memory, and urinary incontinence are very common in our population, especially after age of 70. Up to 20% of population has problems with balance after age of 70. Up to 40% of population has urinary urgency or incontinence after age of 70. But the main thing that people with balance problems and incontinence and memory loss usually need to do is have examination by their primary care doctor and then a neurologist, and have a imaging test, either a CT scan or MRI. And that's where it starts. This diagnosis starts with imaging of the brain. And if there are large ventricles seen, ventricles are spaces inside of the brain that are filled with this fluid. And if either CT or MRI demonstrates large ventricles, that's a first step towards potentially making this diagnosis. It's not the end, but it's potentially significant.
Wow.
And the road to recovery depends on, like I said, response to the spinal tap. How well did Billy Joel respond when he had that spinal tap? Did his symptoms improve significantly after it?
Yeah.
That's a big indicator of how he's going to do.
Well, Dr. Akkerman, thank you for giving us that insight this morning. We will all continue to pray for Billy Joel as he is on the road, hopefully now, to full recovery. Thank you for joining us.